First at 11 o'clock, the top vaccine coordinator for Virginia now says a COVID-19 vaccine mandate is not being ruled out. Good evening, I'm Josh Smith.
I'm Sarah Diamond. That's word from Dr. Danny Avila, who said it won't happen in the near future, but today he said use of a so-called vaccine passport or certification could help address what's being called vaccine hesitancy. And
Dr. Avila said requiring the vaccine as soon as this fall in schools is not being ruled out. And when it comes to scheduling the second dose of the Moderna and Pfizer vaccines, some people really have been struggling.
News Channel 11's Bianca Murray joins us now from our Kingsport newsroom. Bianca, what have you found out is the reason behind the second dose hesitancy?
Josh and Sarah, health experts worry that word of mouth on some side effects could be dissuading some folks from getting that second dose and ultimately reaching that full vaccinated status. However, the biggest hurdle felt by health professionals in both Virginia and Tennessee is scheduling. But here in Sullivan County, they seem to have discovered a solution.
I think that applies more towards the other 7 counties around us, and I'm not trying to be ugly about them, but if they want a second dose, they can come to White Top Monday through Friday.
In Virginia, 9% of folks slated to receive their second dose of the COVID-19 vaccine don't return. The state's vaccination coordinator blames it on scheduling difficulties.
We should have done everything possible to go ahead and schedule that second dose. And even if that meant taking a small gamble with having to potentially cancel an appointment if we didn't receive some of those doses, in retrospect, I think we should have just been much more aggressive about scheduling that, because I think the ease and convenience of that process makes a difference.
April data from the CDC shows the first dose of the Pfizer and Moderna vaccines have an 80% efficacy against contracting COVID-19. But health officials say being fully vaccinated, that's 2 weeks after both Pfizer and Moderna doses and 1 week after a J&J dose, protects you nearly 100% against hospitalization and death from COVID-19.
Obviously, 1 dose of the vaccine is better than no doses of the vaccine, but certainly not something that we want to advocate. Just come get one to achieve the full 95% plus efficacy for both Pfizer and Moderna. It is recommended to do the 2-shot series.
The biggest concern we've heard from our viewers was the difficulty of scheduling that second Pfizer or Moderna shot. But health experts say supply greatly exceeds demand in both Tennessee and Virginia. And you can get those vaccines at basically any pharmacy, health department, or doctor's office. Now, News Channel 11 has reached out to the Tennessee Department of Health, but has not yet received comments on scheduling concerns. Reporting in Kingsport, Bianca Murray, News Channel 11.